The Oversight Committee found the Dora Nginza Hospital to be bad in a very bad condition. It says the most concern was the state of all its service delivery units, from the maternity to general wards and even ambulances. The committee says strong intervention is required to turn the situation around, as the state of the hospitals is going to cost lives. It will return in 3 months to assess the situation.
We are then also going to have a follow-up where we are going to invite them for further discussions on the communications. There's going to be a continuous communication of our committee secretary with the leadership of the Eastern Cape. We're also planning to assist them with having meetings with the Provincial Treasury and the National Treasury to assist them in terms of the infrastructure development, and also with the Minister and the National Department of Health to see what they can do to assist us.
Health unions welcome the oversight visit and say these issues have been known for years.
Further to that, we are hoping that in their recommendation, the issue of putting the department under administration should not be the first thing, but an assistance that is inclusive should then be provided so that the department is able to function optimally and ensure that it achieves what it seeks to achieve. We have further understood that there is a narrative of issues pertaining to preference of CEOs within these particular facilities, but we are of the view that those particular preferences must be subjected to proper recruitment processes.
When people are coming to meet for lip service, then it becomes a problem. One must then look into trenches directly of what is happening within the hospital. Today we saw a total book, copy and paste maybe from Facebook. Then people are starting to say things. The report is not even true. So then can we start having clear reports? Let them come back to the ground. Let us give a chance, but administration is not an option.
The Provincial Health Department says increased funding is required to remedy the situation, but its budget is straining under the weight of medical legal claims of more than 4 billion rand for this financial year. The department says 500 million rand is required to refurbish just the Dora Nginza Hospital.
But what we are taking home as the Department of Health from this exercise is the need for us to be fast, work with speed to finish the complex thing that we see, which you see Livingstone, Dora Nginza and PE Provincial Hospital being a complex that is being decomplexed but not finalized, because you must have Dora Nginza offering the regional services and Livingstone offering the tertiary services, and still include or increase the number of hospitals that are offering district health services. So the reason why people just go from the clinic to a tertiary hospital is something that is never been seen, but it's because we don't get enough district hospitals across the Nelson Mandela Bay, which is something that we must push hard.
The department says that at least 1.9 billion rand is required to refurbish the government hospitals in the Nelson Mandela Bay Metro. Zolani Moya, SABC News, Kariega in the Eastern Cape.